possible. Maybe that might help somebody have enterocolitis. So it's kind of a treatment choice. There were a lot of other drugs used as well. Pepsin was given, and of course bismuth was given, and then hence we have Pepto-Bismol, which is still used today. Hypocyanine is used, which is known as Levsin, and that's used today also as for irritable bowel. Okay, we talked about a little obstetrics. There's a lot of that in the county. Dr. C.T. Ricketts discussed a case in this medical society where he delivered quadruplets. He mentioned how small the patient was and how that she was about 2 weeks early. He delivered a 6-pound, 4-pound, 3.5-pound, and 5-pound baby. Unfortunately, only 2 of them were born alive. This case was presented at Boone County Medical Society about 1912. There was Dr. Ivan Earl Crowell, was a physician in Rabbit Hash in 1910. I think he stayed there in 1924. His journal was in the museum there. In the journal, it mentioned he delivered 360 babies. I visited that museum. It's the second floor of the log cabin in Rabbit Hash. It was kind of nice. It was really nice. And it was very thoughtful of the owners to allow me to bring that journal. It's that black binder there. It has a lot about his life. It didn't say too much about his medical practice, but he did deliver 360 babies. Years ago, Dr. Am and I made a lot of deliveries at the hospital, and I can imagine how suspenseful home deliveries would be. So I'm going to run you through one of those that Dr. Crowell probably had to do. Let's suppose that Mary Rouse of Victory Schoolhouse Road decided to deliver her first baby in the middle of a cold, rainy February night. That's a problem. The day it would be. So she'd have to get her husband Earl to go get the horse up and fetch Dr. Crowell. Dr. Crowell had to get his horse up, put it on a buggy, put his instruments in the buggy, and set out during a cold, wet night in the dark, across the creek to try to find Mary Crowell. Mary Rouse. When on arriving there, he would have to fire up a wood cook stove. Now, I have a wood cook stove like this in my kitchen. It takes me 45 minutes to pour coffee. And so he had to boil enough water to heat up his instruments. And you know, Mary Rouse wouldn't be working on it because she was in labor, so she wouldn't be. So that was a real task for him to do that, to get his instruments kind of sterile. The patient would be screaming in pain with labor pains, first delivery. Dr. Crowell would use this chloroform mask. The way you do it, you take the chloroform mask, put it over the head, face like that, pour chloroform in it. The patient would stop screaming when she became unconscious. Then you take it off, like there was some room air over there. When she started to scream again, you put it back. You get her at a level where she wasn't screaming, and she was not, wasn't screaming, and she wasn't. Then he'd say, Earl, come here. Earl, you give Earl a mask and say, Earl, you got to do this. So Earl, the husband would have to take the chloroform on and off, to try to get it to the right level as far as not screaming, not too deep in anesthesia, but you had to be on weight. Then, after that, he would wash his hands with iodine, wash the face with iodine, and take some hot towels and drape her, and then make the delivery of the baby. Then the baby, he would set the baby on the mother's abdomen. There may be some kind of physiological reaction where it makes the uterus contract down pretty hard, thereby making the placenta easy to deliver. Dr. Crowell would then deliver the placenta and take his umbilical tape out of the hot water and tie off the umbilical cord and cut it with a sterile knife. So the mother and father would be terribly happy with their new baby, and Dr. Crowell would be really relieved because he avoided a breech with a lodged head, a shoulder arrest, a postpartum bleed, and abruptio placenta, which is When the placenta separates too early, and there's a lot of blood, and it separates at 6 centimeters, it's a real problem. These things are all potentially fatal complications of home delivery, in my opinion. And everybody knows we've got to get these pretty little Gerber babies. You know, everybody wants these little Gerber babies, these pretty little babies, and that's what we have to have. So he was lucky he got through that one. Dr. Gladys Rouse was an exceptional physician who practiced in her home on Main Mule Street in Florence. And she was right across from the town hall. So you guys, I know most of y'all remember that. Town hall had a wrought iron fence, had the holly trees in the front, and a well. She was right across the street. Y'all remember that problem. Anyway, she treated many illnesses and found that the enema worked great for many medical problems. When you were sick, with a fever, you couldn't eat, you wouldn't have a bowel movement. Well, she would suggest the cold soap solids enema, because you'd sure get your fever down with putting the cold water inside the core temperature to go down, and you also have a bowel movement. And maybe that's what the problem was. You know, had a fever, needed a bowel movement. But it seemed to work pretty good for her. Medication was also given enemas. And warm water enema would start pregnant lady in labor or something, if you wanted that. It was fairly safe since it really didn't deplete your body's sodium. And that was a good thing. But if you were about 5 years old and your mom got out this red enema bag here, you'd say, "No, Mom, no, not the red enema bag." That'd be pretty uncomfortable. Okay, as you know, sore throats was and is a common problem. It was treated then with, before our time, before my time, it was treated with enemas, aspirin, Iscon, neosilbol oil in the nose, APCs. APCs were aspirin, phenesin, and caffeine. But the phenesin is toxic, it's off the market. Now, there were many other treatments. My favorite one was a treatment by Dr. Harry Doherty, a great and dedicated physician in Florence. What he would do, he would take a swab of methylate and swab that tonsil, pus off the tonsil. Well, the problem is methylate is poisonous. These days, everybody worries about methylate, and methylate is anywhere from 2 to 5%, mercury. And these days, Dr. Doherty has to have a hazmat suit to do it. And we call the Burlington hazmat team to get rid of the swabs. But Dr. Doherty was a really good physician. He treated gastric ulcers, GI bleeding, gastric upset. He treated what he called a sippy diet, where he would give about a cup of milk on the even hours, and on the odd hours he'd give a half a teaspoon of baking soda and cold water. He'd also use Donatol. He repaired laceration in his office, and his infection rate was the same as the surgical suite at St. Elizabeth. And the reason was because he cleaned the wounds with what's called Lister solution. Lister solution is Lysol and carbolic acid. So that's pretty perfect stuff. I don't think you can do that today. But Dr. Doherty was a part of a medical legacy. His uncle Frank was a doctor in Falmouth. His father, Joe Doherty, was a doctor in Walton. And Harry had 2 sons. Turk Doherty was a cardiac surgeon in Texas, and Joseph Doherty, the second, was an exceptional OBGYN doctor in the county for years and years. And then Dr. Joe Doherty the second had a son, Joe Doherty the third, would be Harry's grandson, who is an internist in Cincinnati presently. So he really had quite a medical legacy. There's another doctor in Florence who's had a legacy, in my opinion, was Dr. Hudson. He practiced osteopathy, which is the treatment of diseases with manipulation of the bones and joints. He treated other illnesses as well. But he was one of the early doctors to give sports physicals and treat sports injuries. Today, there's an entire field of medicine called sports medicine, and you can get the residencies in this. So I look at Dr. Hudson's kind of pioneer in sports medicine. During a long conversation with Dr. James Huey, I was pleasantly surprised to hear his accomplishments. He was in World War II in the Burma campaign, and he was highly decorated by the Japanese government. That was Chinese, sorry, Chinese government, for his difficult work in a very bad environment, being South China. And for you people who know a lot about the World War II, is Dr. Huey flew over the hump from Burma into China. Of course, that's a long story. Dr. Huey told me that the way he treated wounds was he would pack them with saline packs 3 times a day, and after he'd take the pack off, he would sprinkle saline on it. Now, and penicillin wasn't invented until 1928. It didn't become widely available until 1944. Malaria is a disease caused by a protozoa in the Plasmodium family and transmitted by the bite of a Anopheles mosquito. It's a pretty severe disease. Actually, it's the leading cause of death in the world today. Back then, it was treated with atabrine. Now, atabrine is a toxic chemical that will really cause jaundice and liver destruction, but it'll kill the parasites in the blood before it kills the patient. So they would use the atabrine, and when it started to turn yellow, they'd kind of turn it off. Dr. Huey came home to Walton to practice, and he made many house calls because there was not a lot of cars, or a lot of transportation was kind of tough back then. And he'd make house calls. His wife would get on a CB and tell him where his next house call would be, which is kind of unique at that time, I suspect. On one home delivery, the husband would not let Dr. Huey examine or observe his wife during labor and delivery. So he had to deliver it to a sheet. And as you see, this is kind of a sheet around a lady's getting ready to have a baby. So that's kind of a difficult thing to do, deliver a baby through a sheet, but he had to do that. There was another doctor, Dr. George Rowley, had a practice in Hebron. He would go to Dr. Huey's office, and they would do tonsillectomies. Dr. Riley would administer the ether in the same old chloroform mask cycle, but he'd use ether. I think people bled less with ether. In 1845, Dr. H.C. Lassen was on his way to join the Confederate Army when he was captured by the Union around Mount Sterling, Kentucky, and he was sent to a prison camp in Lake Erie till the end of the war. Now, Dr. Lassing, or Dr. Huey, was Dr. Lassing's great-great-great-grandson. And Dr. Huey said that Dr. Lassing came back to New Haven, started to practice there, and he had his pharmacy and his horse and saddlebags. Now, I suspect you all probably know a lot about Dr. Lassing, since there's a Boone County golf course named Lassing Point. Pneumonia was a problem in the early years, especially since we didn't have flu vaccines. And a lot of folks don't like them, but they are pretty good. The treatment is really detailed and time-consuming, with sponge bath, mouthwashes, nose drops 3 times a day, total bed rest. They left the windows open to let the cold air in, salt water, potassium carbonate 6 times a day, calamine, castor oil, of course, the universal animal. I guess they were trying to purge it again, purge the sputum out of the abdomen, or some reason they were trying to purge the offending agents out of the body. Mustard plasters were also used. Now, mustard plasters, that's mustard powder in mustard oil impregnated into gauze pads, gauze. And they would put that on the chest, I guess hoping to bring heat to the area of the lung.